Hi guys, the next video we're going to do is helping the person walk. For equipment and supplies, robe, non-skid shoes, transfer belt, paper or barrier, cane, and walker. Now, they don't, let's see, go step 1, step 2, step 3, again, somehow identifying those 2 identifiers such as name and date of birth. Hand hygiene will be hand sanitizer. Providing privacy. Now again, they can pull the curtain. They can ask the patient if they would like the curtain closed or the blinds lowered. Those all would be okay. That tells us that they're thinking about the privacy of the patient. Again, collected and needed supplies. If they have the stuff with them at some point during the skill, then they've got that step. Fan folded the top linens to the foot of the bed. Place the paper under the person's foot. Put the shoes on. So this is a little bit different. We're doing their shoes on in bed, so they want that barrier of some sort. Paper towel probably is the cheapest thing to use. Help the person sit on the side of the bed. Made sure the patient's feet were flat on the floor. That's step 10. Step 11, help the person put on the robe and made sure they're dressed appropriately. Now, we don't necessarily have to put on the robe. They can ask the patient, do you want to put on a robe? And we can use a hospital gown that's backwards can be considered our robe. But if the patient states no, or they may say, well, I asked the patient and they said they didn't want the robe, they're still identifying. We have evidence and that supports that they know that we're for the dignity of the patient. And if they look and they're dressed appropriately without that robe, then we don't actually need to put that on. Again, we want them thinking and talking with that patient like they would, mimicking what they would in the real world. Step 12, apply the transfer belt at the waist over the clothing. We are not testing an actual procedure with transfer belt or gait belt. So facilitating lab instructors, when they're doing peer checkoffs, you need to show them how to do the gait belt and how it sits appropriately. Because we won't test on that. Help the person stand, grasp the transfer belt at the side. Step 14 is critical. Stood at the patient's weak side while the person gained balance, held the transfer belt at the side. At some point they need to either be checking what that weak side is. Step 15. Some sort of encouragement, while they're walking, telling them to, stand tall, look forward, don't look down, something like that. Anything like that would give them points for 15. 16, help the person walk to the side or slightly behind on the weak side. Provided support with the transfer belt, encourage the person to use the handrail on his or her strong side, unless they're using a walker and cane. So, obviously we don't have handrails in our rooms, but if they made a statement, well, there isn't a handrail here, but if there was, I would have the patient, utilize that with the strong side. They need to give some sort of indication of that in step 16 about what they would do if there was a handrail. If they don't, they're not going to get those points for 16. It's not a critical, they'll just lose 1 point. And then we go into the walker. The big things for walker is they need both A and B. We're looking that walker was 6 to 8 inches in front of them. The patient's holding it with both hands or they've instructed that patient to do so. And then we're looking that they're moving the weak leg first and then the strong leg. They don't have to walk very far, so we can see that they're doing, the walker weak strong type thing. And then we go on to the cane in steps 18. Again, we're looking that the cane is 6 to 8 inches in front of. The weak leg, which is opposite of the cane, is moved even with the cane. The strong leg is moved forward and ahead of the cane and the weak leg. So we want to see them, doing all of that. They could instruct that patient, to what to do, so that patient can do that. Step 19, again, they're encouraging the patient. just walk normally. Let me know if you're getting tired. Make sure you're stepping with your heel first, then your toe. Some sort of encouragement. We want to see them encouraging that patient. They don't necessarily have to say that they would discourage shuffling, but they want to encourage the patient. Okay, just walk normal, heel, toe. Something like that would get them all the points for 19. Step 20, we would really like them to make some identification that they look to see how far the patient should be walking. A lot of patients are on the walk to dining. But most importantly, we want to see that they're asking the patient if they're okay. Are they tolerating how far they're walking? That's how it's going to earn them the points for 20. Did they tolerate it? Are they concerned about whether they're okay? They're not hurrying them along, those kind of things. That would earn step 20. Step 21, really nothing. Step 23, we want them, again, if they ask the patients if they want their shoes off, or ask them if they want to go back to bed, and then maybe the patient doesn't go back to bed. They say no and they go to the chair. They offered the bed and they would still get 22 even though that patient chose to go, because they did offer the bed. 23, they removed the shoes and the sheet from the bottom. Call light, made sure all those items are in reach. Again, if a robe wasn't utilized, then that's not part of the equation if that patient refused it. The shoes, make sure, again, asking the patient, where would you like me to put your shoes? That's how they determine the proper place. Unscreened, again, opened up that room and that safety check, and then hand hygiene would be utilizing the hand sanitizer. Again, in step 29, instructors, I know this is really going to be hard because we've been told we can't speak. It is okay in step 29 to ask, okay, what would you, when they say they would document this, ask them with a follow-up, what sort of things would you document? We want them to think about it. Okay, well, they tolerated it. They didn't have pain. They weren't short of breath. Those are the kind of answers that we're wanting. It's not a bad thing to encourage them to tell us that. That's how we know they know what they're doing. And we stimulate those thinking. Again, the quality of care is going to be the same, and so will those key concepts. If you have any questions, please let me know. Please, please, please respond to or reply to this video and start a discussion with the other instructors, so that way we can all see and hear what everybody is feeling towards this checkoff sheet. Have a great night, and I will see you soon.